Hello mates, welcome to our VETGJ community. Today we are starting fundamentals of pathology and in fundamentals of pathology we are discussing growth adaptations. Let us understand what is pathology. We all know physiology. No? We have to study under physiology we have to study normal behavior. In pathology we are doing with um, study of behavior under stress or study of disease causing organisms where we can be specific study study the abnormal behavior. Come, let's go to growth adaptations. Start our video. Growth adaptation. uh, why growth adaptations are required? When occurs under stress, organs undergo growth adaptations or show growth adaptations. Whenever the stress is there in the organ, it will undergo growth adaptations. Whereas stress, depending upon the stress, the very uh, how the stresses varies. mm, in that way, growth adaptations organ will show. The organ will show in response to stress. Growth adaptation will be shown. Let us discuss increased stress conditions. Whenever the uh, stress is increasing on the organ will shows the growth adaptation as increase in organ size. Increase in organ size occurs in two ways. One way is increasing number of cells in that organ, so that organ can increase in size. It is called hyperplasia. It can lead to dysplasia and cancer. Cancer, we all know, uncontrollable growth. Whereas dysplasia, later part of the video, we will discuss about dysplasia and how it occurs. Hyperplasia, how it occurs. First, hyper means more than normal. Plasia means growth. How hyperplasia occurs? Production of new cells from stem cells. It is normal only. Let's come to cells increase in size. Individual here, individual cell will increase in size. It is called hypertrophy. Here only individual cell will increase in size, so that organ size will increase. This is called hypertrophy. How it occurs? By gene activation, protein synthesis and production of organelles. In that way, cell size will increases, so that organ will show increase in size. When permanent tissue, there are tissues are two types: permanent tissue and meristematic tissue. Permanent tissue, meristematic tissue. Permanent tissue, after attaining the maturity, after the tissue attaining maturity, uh, the ability to divide further. After attaining maturity, the ability to divide further is not, can't able to divide further. The tissue is called permanent tissue. After attaining maturity, the tissue can divide further. It is called meristematic tissue. Examples of permanent tissue are cardiac and nerve, skeletal tissue. Cardiac tissue, nerve tissue, skeletal tissue. Example: when we are doing exercise, our skeletal muscles undergo hypertrophy. Let's discuss about decrease in stress conditions. In response to decreased stress conditions, organ will show decrease in organ size. It's called atrophy, means absence. Trophy means size decreases. How it occurs is also two ways, like decreasing number of cells and decreasing individual cell size. Decreasing number of cells is called apoptosis. Apoptosis is nothing but programmed cell death. It is a programmed cell death, and we will discuss detailedly apoptosis and necrosis in later part of our journey. And decrease in cell size, how it occurs? Why ubiquitin proteasomes degradation of the cytoskeleton. Degradation of the cytoskeleton, we know the cytoskeleton mm, major part of the cell structure. In autophagy of cellular compound. Autophagy is a how I can say autophagy. It is a metabolic process. During starvation condition, our body consumes our body tissue. as a metabolic process. It is autophagy. During starvation conditions, our body reserves will use it as food material. Metabolic process to consume our body during starvation condition. Let's discuss about metaplasia. Metaplasia, change in stress on organ leads to change in cell type. Whenever the stress conditions are going to change, the organ lead, the organ also leads to change in cell type, commonly seen surface epithelium. Like discuss about bracket esophagus so that you can understand easily. Whereas esophagus has um, simple epithelium, whereas stomach has uh, columnar epithelium. Simple epithelium, simple epithelium of esophagus mm, changes in cell type to form columnar epithelium, which is as same as stomach epithelium. The new cell type is called as metaplastic cells. The new cells are called metaplastic cells. And we have other examples like vitamin A deficiency, keratomalacin, and metaplasia can also leads to dysplasia and cancer. And cancer we know uncontrollable growth, except apocrine metaplasia, breast cancer. In oncology, we will detail we learn. And metaplasia is reversible, occurs via reprogramming of cells, stem cells. How metaplasia occurs? Via reprogramming of stem cells. Mesenchymal tissues can undergo metaplasia. Mesenchymal tissue can undergo metaplasia. Okay. Dysplasia. This means disorder. Plasia means growth. Disorder cellular growth. Disorder in the cellular growth is called dysplasia. Can lead to carcinoma. Guys, all you know, carcinoma is reversible, whereas dysplasia is reversible. Comes to aplasia. A means absence, plasia means growth. A means absence, plasia means growth. Absence of growth. Whereas complete absence of growth. This is failure of cell production during embryogenesis. Let's hypoplasia. Hypo means less, plasia means growth, whereas less growth compared to the normal growth. Relatively smaller organs occurs during embryogenesis, decreasing less production, decreasing cell production. Don't confuse with aplasia and hypoplasia. Whereas aplasia means complete absence of growth, hypoplasia means whereas growth is there, which is not sufficient to, which is not comparable to normal size. Thank you for watching. Please subscribe our VETGJ YouTube channel and follow our latest updates. To follow our latest updates, hit the bell icon. Thank you for watching.